Leg edema refers to the swelling in the legs caused by the accumulation of excess fluid within the tissues. This condition is often noticeable due to the visible enlargement of the lower limbs. Excess fluid accumulation leads to swelling and discomfort in the affected leg. In a healthy body, fluids circulate efficiently, maintaining a balanced distribution. Leg edema results from a disruption in fluid balance, leading to abnormal fluid accumulation in leg tissues. Disrupted fluid balance causes an abnormal buildup of fluid in the leg tissues. Prolonged standing or sitting can cause fluid accumulation in the legs due to gravity. Fluid pooling in the legs leads to mild swelling, also known as edema. This type of leg edema is typically temporary and a common physiological response. Poor circulation impedes the effective return of blood from the legs to the heart. Inefficient blood return can result in fluid accumulation in the lower extremities. Fluid accumulation in the legs leads to swelling. Varicose veins are characterized by damaged valves, leading to blood pooling in the legs. The damaged valves prevent efficient blood flow back to the heart. Blood pooling in the legs due to damaged valves contributes to edema. Heart failure impairs the heart's ability to effectively pump blood throughout the body. Ineffective blood pumping leads to fluid accumulation in the lungs and extremities. Edema, or swelling, is a common symptom of heart failure, particularly in the legs. Kidney disease can disrupt the balance of fluids and electrolytes in the body. This disruption leads to fluid retention, causing swelling, particularly in the lower extremities. Edema, or swelling, is often observed in the legs and ankles due to fluid retention caused by kidney dysfunction. Liver disease can impair albumin production, a protein crucial for maintaining fluid balance in the bloodstream. Albumin deficiency reduces oncotic pressure, leading to fluid leakage from blood vessels into surrounding tissues. Fluid accumulation in tissues due to albumin deficiency results in edema, characterized by swelling. Leg injuries, including sprains or fractures, can trigger localized inflammation. Inflammation and swelling are the body's natural responses to trauma. The inflammatory response is a critical part of the healing process after an injury. Certain medications can cause fluid retention as a side effect. Blood pressure medications, steroids, and hormones are common culprits in medication-induced edema. Medication-induced fluid retention often leads to leg edema. Deep vein thrombosis, DVT, is characterized by the formation of a blood clot within a deep vein. DVT can obstruct blood flow, leading to significant swelling and pain, typically in one leg. Immediate medical attention is crucial when DVT is suspected to prevent serious complications. Lymphedema results from a blockage or damage to the lymphatic system. The lymphatic system is responsible for draining fluid from tissues throughout the body. Damage or blockage of the lymphatic system leads to fluid accumulation and swelling in affected areas. Persistent leg swelling requires medical evaluation to identify the underlying cause. Medical evaluation helps determine the appropriate treatment plan for leg swelling. Ignoring unexplained leg swelling can lead to delayed diagnosis and potential complications. Skin discoloration in the swollen area may indicate a serious underlying condition. Increased pain, warmth, or tenderness in the swollen area warrants immediate medical attention. These symptoms, when observed together, suggest a potentially severe medical issue requiring prompt diagnosis. Sudden onset of leg edema requires immediate medical attention. Leg edema accompanied by chest pain or shortness of breath may indicate a serious heart or lung problem. Prompt diagnosis and treatment are crucial to address the underlying cause of sudden edema and prevent complications. Edema in one leg is often caused by a localized issue, such as deep vein thrombosis, DVT, or injury. Deep vein thrombosis, DVT, occurs when a blood clot forms in a deep vein, obstructing blood flow and causing swelling. Edema in both legs is more likely indicative of a systemic condition, such as heart failure. Diagnostic tests are essential for identifying the underlying cause of leg edema. Blood and urine tests can provide insights into kidney function and protein levels, which may contribute to edema. Ultrasound and venography are imaging techniques used to assess blood flow and identify potential venous obstructions. Blood tests can assess kidney and liver function to determine the cause of edema. Electrolyte levels in the blood are measured to help diagnose edema. Blood protein levels are assessed as part of the diagnostic process for edema. Urine tests can reveal irregularities in kidney function. Elevated protein levels in urine may indicate kidney damage and contribute to edema. Detecting kidney dysfunction through urine analysis aids in diagnosing fluid retention issues. Ultrasound imaging can visualize blood flow dynamics within the legs. Ultrasound can identify the presence of blood clots within the leg veins. Ultrasound can diagnose venous insufficiency by assessing valve function and blood reflux. Venography involves injecting dye into the veins to visualize their structure. The dye allows medical professionals to identify any blockages or abnormalities within the veins. Venography aids in diagnosing the underlying causes of edema by providing detailed venous imaging. For mild edema, caused by prolonged standing or sitting, elevating the legs can help improve circulation. Compression socks can also reduce swelling by supporting veins and promoting better blood flow. Improve circulation and support from compression reduce fluid accumulation in the lower extremities, alleviating edema. Compression socks support veins and improve blood flow in the legs. Improved blood flow reduces fluid accumulation, mitigating edema. Compression therapy utilizes specialized socks or stockings to provide external support. Regular exercise can improve circulation and reduce fluid accumulation in the legs, helping to manage edema. Maintaining a healthy weight reduces pressure on veins and improves overall circulatory function, thereby alleviating leg edema. Reducing sodium intake decreases fluid retention in the body, which can significantly minimize leg edema. Adhering to healthcare provider recommendations is crucial for managing leg edema. Proper treatment and management of leg edema helps prevent complications. Following medical advice improves overall health outcomes in individuals with leg edema.